So with this case, what are we going to discuss here is about the barbiturates. Okay. So systematically, like a theoretical class, we will just go through barbiturates. So as you know, you are using it already in anesthesia and even inside operation theater, outside OT, in electrical convulsion therapy, ECT therapy, which you give for the psychiatric agitated patients as a part of therapy. So there also you use barbiturates, and they are potent CNS depressants. So how they work? So they work just to open this chloride channel, okay, and they keep it open for a long time. So this was a GABA. This is a GABA A receptor complex in CNS. Okay, so it has a chloride channel. So this GABA-A receptor complex is a receptor in the CNS, where the GABA is attached. Okay, and then GABA shows some effect. So this GABA is a basically neuro inhibitor. Okay, so it's an inhibitory neurotransmitter. So what happens, that barbiturate and even benzodiazepine also attaches itself to the GABA receptor complex. So these anesthetic or hypnotic drugs attach, and they just keep open the chloride channel through which the hyperpolarization occurs, and later what happens is that there will be inhibition of brain nerve activity. Okay, so this is the whole pathophysiology, how barbiturate work. So they keep open the chloride channel inside the GABA receptor complex, so that GABA can go through these channels and continue its effect over the neurons, basically neuroinhibition. All right, so this is the role of barbiturate, mechanism of action of barbiturate. What is the mechanism of action of benzodiazepine? We will learn here itself. So benzodiazepine also can open it, but it increases the frequency of opening of chloride channel. Okay, so the barbiturate opens the chloride channel for longer duration of time, and benzodiazepine opens it for a shorter period of time, but it opens very frequently. The frequency of increasing this channel or gate becomes more and more with the benzodiazepine. So this is the basic difference in the mechanisms of action of barbiturate and benzodiazepine. So just to remember. So what are the other properties? So barbiturate have various medical indications, as you know, in OT, in psychiatric clinic. It has been used as hypnotics for insomnia, sleeping medications basically, and also sedatives, and for the treatment of alcohol withdrawal syndrome, alcohol withdrawal seizures also. It can be used. It can be used as a part of very important drug to induce pentobarbital coma in cases of super refractory status epilepticus. So where nothing is working, maybe barbital coma can work. And in patients in whom you want to control the ICP, where other measures have been failed, so there also you can induce the pentobarbital coma, all right, to reduce the ICP in neurosurgery cases. Okay, the post-operative and traumatic brain injury cases, it has role. So barbiturate has still a lot of indications. And as I told you, after 1950s, the role of, the indications of barbiturate have come down because of safer alternative, which is benzodiazepine. Why? Because of narrow therapeutic index. So the drug which has narrow therapeutic index, the problem is that the moment you increase the dose, okay, it can cause fatal consequence, it can cause complication. Okay, so this is the problem. So the therapeutic index is very low, and it has very high addictive liability. So that is also a problem with the barbiturate and with any other hypnotics or sedatives. They are all addictive drugs. Okay, now who are the victims? What kind of patients are going to come to emergency department, and how will you identify them? So these two basic important questions you have to remember. So acute barbiturate poisoning occurs in patients who have, or the caregivers, even the healthcare providers also are the victims, because they all have one common thing. And what is that? So that is access to the drugs. Okay, so if you have an access to the drug, you have plenty of that, then you are victim. Okay, so mainly the patient, the people who have access, patients as well as caregivers. And uh, it can occur, intentionally or unintentionally also. So intentionally, as we know, you can give it, you can take it, or you can give it, like suicidal or homicidal. But it can be unintentional also, like it can be an accident. All right, so accidental overdoses are possible. And it can be sometimes hydrogenic. Okay, so when you are using barbiturate, uh, a short acting barbiturate, and you are giving multiple doses, so you may overdose, and that can cause cardiovascular, pulmonary complications. Okay, so now we have to remember one thing, that the barbiturates have been classified according to duration of action and onset of action, basically duration of action. So we have long acting, we have short acting, we have ultra short acting. So we have about so many types of barbiturates. So why this information is important, I will tell you later. Okay, so this also you have to remember the classification of barbiturate, so that you can manage the patients better. So regarding the clinical signs and symptoms, so it is very important when a patient comes to you, or patient relative come to you, you have to gather a proper history. So comprehensive history from the patient and their relatives is very important, because you need to know the type of the drug, maybe one, maybe two pills, other types of co-injections are possible, like alcohol, like opioid, benzodiazepine, chloral hydrate, other hypnotics, other drugs are co-ingested. Okay, so co-ingestion history of other drugs is also very important. And you need to gather the history about the comorbidities, especially the liver disease, especially the congestive heart failure and kidney diseases. Because if a patient has any one of these chronic diseases, the elimination is going to come down, and the patient will develop the toxicity for a longer period of time. So that is why you have to have the history of comorbidities as well. Okay, and physical examinations, you should check the neurological status, reflexes, and you should check the uh, pupillary signs. So about the pupillary signs, there is one unique thing about barbiturate, is that uh, even in cases of coma, the Jesus drops so much. Barbiturate poisoning does not affect the pupillary reflexes. So pupillary reflexes, the reaction to light is intact. So this is one particular thing about the barbiturate poisoning as far as pupillary reflexes are. But pupils may constrict initially, but there will be meiosis, as we see in cases of by benzodiazepines poisoning. So there will be meiosis initially, but later cases, there will be dilatation. In the severe cases, you will see pupillary dilatation, that is called mydriasis, all right? And then depending upon the dose taken and time duration since injection, you will see myriad of complications, the respiratory depression, desaturation, cardiovascular collapse in the form of hypotension, initially tachycardia, then bradycardia, all those things you might see. But the CNS depression is the first and foremost thing which you would like to see in a patient. So what is your going to what is your approach? What is the ideal approach to handle such kind of patients when you see the patient in emergency? Like toxidrome, this is important term. All right. So in toxicology, in poisoning, the science of poisoning, toxidrome is the important term. which is nothing